David, tell me about this announcement. Must be very excited about this.
Yeah, this is great. A big day for Northumberland. $5.5 million for this incredible hospital, which includes making previously signed one-time bed funding of an expansion of 10 new beds, fully operational from here forevermore. A significant increase in base funding of over $2 million to this hospital, and additional supports that you heard to support a program for on-call physicians that was frozen by the previous Liberal government. We're now expanding it, supporting on-call services with a specific focus on acute care services like mental health. We know that needs increase. So a great day, but I mean, this wouldn't be possible without the incredible dedication and hard work of the staff and the leadership, the board, who are always giving government great feedback on the needs of this community.
Susan said that you've always been an integral part of this. Your ears have always been open for this hospital. Explain a little bit about that, why that's important, for obvious reasons, but I mean...
Well, it's important. I think you got to listen, got to understand what the concerns are. I remember when I was first elected, the failed funding formula. You know, that was a funding formula that I felt the previous Liberal government disadvantaged medium and small hospitals in rural Ontario. So we fixed that, and that meant a massive increase in base funding that we announced in 2019-2020. We've continued that ever since, but you got to listen and understand. I know that often the solutions we bring, sometimes it's not as fast as they would like, and you know, there's always challenges along the way, but the point is, if you're both there in the car together on that journey, you can get to your destination a lot faster. So I've really appreciated their advocacy, the always succinct briefing notes, the opportunity to pick up the phone, to understand and really game out where those challenges are, have that conversation, so that hopefully, you know, I can be the strongest voice I can for this community at Queen's Park.
That I always do that. And we have Don, who's here from a parliamentary assistant. So thank you. We also have in the audience, we have our staff, we've got our board members, we have members of our municipality, we've got our mayors, and we've got our vice chair, Cindy Gilmer, who will be coming up to say a few remarks. So it's really my pleasure right now to introduce David Piccini, who will be making an announcement.
Yes, thank you. Thanks, Susan. Thank you, everyone. Really nice to be here with all of you, and I really appreciate Susan always taking some time to bring me in to the hospital to meet with senior team and others. I mean, always just a phone call away if you ever want to meet and chat. And I know sometimes it's being, you know, from a public policy politicians, you come in, announce, and leave, and I always value that you open the doors for more than just an announcement, but to sit down, to have a conversation, to understand what the challenge is the hospital's facing, how we can help, because the only way we can address it from a public policy standpoint is to have an open dialogue. So I even got a few good ideas to take back just now, having a conversation. So I really appreciate that, and I want to thank you for always challenging us to do more and to really think outside the box as government officials. Our province is growing, and it's no secret. We're an hour east of the largest city in our nation. We're welcoming hundreds of thousands of new Canadians to our country every year, and we are an exciting time for someone like my granddad, who came here with nothing in his pockets, built a future, and now his grandson is an elected member of parliament. That's the opportunity that Ontario offers. That's the opportunity that this nation offers. But for too many, that dream has become out of sight. For too many, home ownership. For too many, all of the prosperity that you know we have has become out of sight, and it's time we change that. And so building the infrastructure we need to support a growing province is a priority of the government, but we understand underpinning that is a robust healthcare system. A healthcare system that supports innovative models of care, and a healthcare system that supports our hospitals that are on the front lines of delivering healthcare service. So I want to thank again the NHH, Susan, you and the team for all you do. You're here not just for me and my family who live locally, but you're here for all of us, everybody who lives in this communities, for some exciting days and some of those difficult days where you're not expecting to walk through these doors, but you're always here with a smile, and here to care for people in a compassionate way. So I'm excited. I mean, Ontario's doing a lot of innovative things, training more physicians, with more publicly funded spots in universities, more nurses, allied healthcare professionals, again, more publicly funded spots, but looking at innovative partnerships to break down barriers. I mentioned the story of my grandfather. For internationally trained healthcare professionals, it's unacceptable, the old adage, my cab driver's a healthcare professional. It's unacceptable, and to address that, the government supported things like the Community Commitment Program for nurses that offers a $25,000 incentive program to work in underserviced areas and helps upskill and train and match. And to date, that's supported over 2,600 nurses, for example, in entering the profession who've been trained elsewhere. And we've got to keep doing that. Supporting underserviced communities is key, and as a part of the budget, as a part of the last year's budget, we've invested more in hospitals across the province of Ontario. But what does that mean for NHH? Why are we here today? Today, I'm proud to join Parliamentary Assistant Dawn Gallagher-Murphy, who's been an absolute champion on the healthcare file and has been leading primary healthcare team roundtables, and she'll be joining me after this for a roundtable on primary care. And both of us are proud to announce here today an increase and an investment of over $5.5 million to Northumberland Hills Hospital. So what does this mean and what does this look like through hospital allocation? Northumberland Hills Hospital will be receiving a $1.8 million base increase, which not only went into supporting the delivery of core clinical services, but was used to address increased demands related to population health growth. This is from the 850 fund in the budget, which is a 4% increase to enhance access to key health services. It's also to support the hospital on-call coverage program. This funding was frozen by the previous Liberal government in 2015, and we're pleased to re-establish and expand this program. This supports general practitioner and specialist on-call availability at Ontario hospitals and to incent physicians to provide on-call coverage, especially for the provision of emergency and after-hours care. Through this funding, Northumberland Hills Hospital received $1.5 million to support physicians after hours, especially in specialties like mental health. As a part of the healthcare infrastructure upgrades, Northumberland Hills Hospital will also be receiving funds, and lastly, on bedded capacity increase. This is an exciting one. Northumberland Hills Hospital was supported. You know, Susan has always said often you're operating above your bed capacity, and we know that that is a reality. So I recognize that. I'm not standing here before you today patting myself or the government on the back. We know we've got more to do, but I think recognizing those challenges and the one-time base funding, and now stabilizing that long-term for the hospital is an important step. And through that, I'm proud to say we're investing $2.1 million, and that's 10 new beds that was one time, is now permanent forevermore here at the hospital. So in closing, I just want to thank all of you for all that you do. We're joined by municipal partners because this is a team effort. I see a number of you here today, wardens, mayors, councillors. Thank you for joining us. I think we're all seized in this community with the recognition that we've got to do more to build housing, we've got to do more to build the critical infrastructure that we need, and we've got to work together to wrap our arms around patients to deliver better patient-centered care. We're going to continue to do that as a government, but I can't do it without all of you. So once again, Susan and the team, thank you. And the board, thank you for all you do. Thank you for challenging us and always never shying away from giving us the feedback we need to hear. So thank you for having me here today, and I'm proud to turn things over.
Good morning and welcome. My name is Cindy Gilmer, and I have the privilege of serving as the Vice Chair of the Northumberland Hills Board. It's my pleasure to bring thanks on behalf of the Board of Directors and the community members for today's announcement. Piccini, Parliamentary Assistant Gallagher-Murphy, thank you both very much for being here today. It's a beautiful day for this, and you bring great news, which is wonderful. We're a growing hospital and a growing community. We feel that at every board meeting. The dollars that you've highlighted today will help ensure that NHH is not only here for our patients and families who need us today, but all those that join us in the future. So in October, we will celebrate our 20th anniversary. Congratulations to everyone about that. 20th anniversary on this site. So Guided by our strategic plan, we've got lots of plans to grow and expand in our ICU, our surgical services, our inpatient rehab services, mental health, and more. We're confident with the government's support that we'll be able together to meet all the competing needs while operating a hospital that is welcoming and supportive to the many health and human resources needed to deliver care. Minister Piccini, you've been from day one a supporter. We appreciate that. A strong advocate for our hospital. On behalf of the board, I will conclude by extending my personal thanks for your continued support and advocacy with NHH. Thank you for being here as well today. It's a privilege. We know that our hospital is your hospital, and that's near and dear to your heart as well, and we appreciate that.
Thank you very much.
Thank you, Cindy, for the bringing words from the board. I just wanted to say before I make my comments that I agree with you, David. I've been in the CEO role now for this is my 2-year anniversary this month. And over that time, I have seen a lot of growth happen in this organization. And before I say any remarks, I do want to acknowledge, as you did, Dawn, all of the staff, the physicians, our therapists, our volunteers. We are a successful hospital because of the people that are in this hospital today doing the work that they do, and we have many of our management team here in the audience as well as our board, and they know too well the impacts and the impacts of positive funding that we receive. And David, you have been a great support to us. He's very right. Anytime I can pick up the phone, I can call David and I can talk to him about the issues that we're facing, and I feel like he's always listened, and he really does try to look after NHH in our region. The government's commitment to NHH has been consistent and is greatly appreciated. This announcement today of the $5 million will allow us to continue to do the work that we do every day. We do have a very aggressive growth agenda. We will be opening a new OR so that we can increase our surgical services and help the province reduce wait times for surgeries. We will be in September opening an integrated stroke unit, which really is bringing a level of care to this organization that has not been in existence before. Our ED volumes are up, our surgical volumes are up, and our inpatient access to demand has also been increased. So these funded beds will allow us to continue to staff those beds, buy equipment, and support the day-to-day operations of this hospital. However, we know that with increasing inflationary demands, as well as other pressures that we're facing, that the demand for funds will continue, and we know that MPP Piccini, and through the work of the Minister, will continue to support us in that way. So today, I just want to, heartfelt on behalf of the NHH team, and we are a team, say thank you to MPP Piccini, thank you, Dawn Parliamentary, Darren Gallagher Murphy, and thank you to all of the guests that came today to celebrate with us this wonderful announcement.